Matt. I know y'all want to talk about venomous snakes, and we do too. So I'm going to turn it over to Austin. He's going to give a little intro, and then Nasir is going to step in and take it from there.
All right. So like he said, I'm just going to give a little bit of introduction before Nasir takes over, and he can talk about it a little more in depth. So I'm just going to highlight the global distribution of venomous snakes. As you can kind of see, it's pretty much everywhere except for like Canada. So I think this kind of highlights why it's an important topic, because like it's everywhere. So it's kind of important to cover what you're going to do when you're actually outside in the wilderness, kind of like he said, and then what you might see in the ER and the hospital and the kind of techniques they use to treat venomous snake bites and stuff like that. So in Arkansas, we have the biggest venomous snakes that we have are typically like the cottonmouths or like water moccasins, the copperheads, and the rattlesnakes. Now these probably aren't like the most venomous snakes in the world, but they're pretty bad here in Arkansas, and especially like the water moccasin and rattlesnake can be pretty deadly, especially for like children and older adults, like elderly and stuff like that. So now I'm just kind of like, this kind of highlights the need to talk about the venomous snakes here, especially in Arkansas, and I'm going to hand it over to talk about how the treatment works and how that works.
So hey all, they kind of gave me a pretty good introduction. So the first thing I wanted to do is just talk about the different venomous snakes that are present in Arkansas, and it's kind of also it represents the snakes that are all across the United States as well. So they have the same families of snakes. So the most important thing to do is to recognize what is a venomous snake, what is not, and when you need to get the proper care. So we have two families. We have the pit vipers, so that's the cottonmouths, copperheads, and rattlesnakes, and then we have coral snakes. And so coral snakes, and we'll get into this a little bit later, are not too big of a deal. They're in a very small portion of Arkansas. They are toxic, but the treatment for them is very good, and you don't have long-term effects. So we start out with the cottonmouth, which is probably one of the most well-known snakes in Arkansas. It has a really bad reputation for being aggressive. They are super hematoxic. So like when you do get a bite from one of them, you get like immediate swelling, pain, and you need to get to the ER as soon as possible. And so as far as distribution goes, we can find them all throughout Arkansas. So like wilderness medicine, they were kind of talking about it. It begins the moment you leave the clinic or hospital. Well, for here in Arkansas, this is just pretty much anywhere. So like we go to Two Rivers a lot, and that place is absolutely full of them. And you see there's families picnicking, there's walking around without shoes on, and those are all very difficult situations to control when there's also cottonmouths in the area. And I did try to put as much info as possible for these slides, so whenever you have this at home, we can send out this PowerPoint so people can keep this information. So the copperhead is also distributed throughout the full state. It's similar to the cottonmouth, not as toxic, and it's actually the one that is known in the US for the most bites, just because there's so many of them. They're not very aggressive at all, but again, you need to go to the hospital if you ever get bit. Rattlesnakes are the things that we kind of fear the most. In Arkansas, we don't worry about it too much in the sense that they are distributed everywhere, but there's not many of them. And so with the timber rattlesnake, there's probably been like 10 bites in the state of Arkansas for like this year, which is not very many, and there's been so they are known to be pretty gentle, and I know that sounds like an oxymoron, but they are. They use the rattle as a warning sign, and that just tells us to be careful. The western diamondback is the biggest venomous snake in the United States. It's to 5 to 7 feet sometimes, and this one is not distributed throughout the states. It's probably like 2-3 parts in all of Arkansas where there's really any interaction with them. It's super difficult to find, so it's not something you need to worry about. But if you ever did have a bad interaction or you were bitten by one, this is a scenario where you you'd probably want to get like helicoptered to the nearest hospital. It's the amount of venom that they produce is massive. And then the pygmy rattlesnake is really tiny. It only gets up to around 2 feet. And I mean, in my whole time in Arkansas, I've never seen one. And I only know a few people who have actually interacted with them. And then the Texas coral snake is the last venomous snake. It's the one that's related to like cobras and kraits and all those like crazy venomous snakes. So it's a neurotoxic snake, which means the way the, what's that? Okay, gotcha. So with these snakes, you can have symptoms come in maybe like 10, 13 hours later, and it's not like you won't even realize you've been bitten sometimes. So then we get to handling of snakes and what to do if you see snakes in the wild and whether or not you should pick them up or not. So I just grabbed an example from Facebook of a person who posted this picture here and said, hey, I think this is a rat snake. They were very wrong. It's a cottonmouth. And so they put themselves in a very dangerous situation. This actually is a big issue. I think we were talking about it earlier, me and Brett, but the age group of like 18 to 26 for men is most likely to get bit on their hands because they're picking up snakes that they don't know what they are. So one thing I always highlight is you should use multiple identification techniques in deciding whether I should pick up the snake or not. I like to pick up snakes. I know that's not everybody's thing, but you know, we are in Arkansas and a lot of people do that. So there are only 6 species of venomous snakes in Arkansas, and there's 36 species of snakes in general. But I mean, almost like 97% of the actual snakes in the state are non-venomous. So that's why it is a smaller issue. It's why there's not that much anti-venom in hospitals. There's probably like 5,000 to 6,000 venomous snake bites in the United States every year. And so from that, I think it's like 5 to 10 deaths a year in the United States as well, which, you know, we want to mitigate that as much as possible, but it just highlights it's not as big of an issue as it used to be. So a similar situation with this person here, they picked up a copperhead and they ended up in the hospital afterwards. They posted these to Snapchat. So that became a little bit viral. But what we really want to highlight is when you are going out into the wilderness, you should be prepared for these sort of situations. You should always wear boots when you're hiking. You should look where you're stepping. You should not be reaching blindly. This even goes for like gardening in your own yard. People will reach for something and then there's a snake in there. Today I saw a snake bite where they got into their canoe and there was already a copperhead just sitting in there. And so I think they stepped on it. So in that situation, I would not be wearing boots in a canoe. I'm either going in chacos or barefoot. So we just have to be vigilant for those sort of situations. So I wanted to address a couple of myths that people believe about snakes that are like old wives' tales. So the first one that I hear all the time is that baby snakes are more dangerous than adults. This is not true. You don't want to be bitten by any of them, but certainly not an adult. That is a much more dangerous situation. The babies have just as much control on their venom. And so this happens to be like probably the most common rumor I've heard or myth when I was at Two Rivers with some of my classmates. Literally some woman came up to us and she was like, you know, you shouldn't be picking up those snakes. The babies are really venomous. 1, I wasn't picking up a venomous snake. 2, that's not true. The next thing is that people try to identify snakes by looking at their head shape. And so that can be helpful, but you can't just go based on that alone because most non-venomous snakes also have the capabilities of making their head look triangular. And so people kind of get confused on whether it's going to be a venomous snake or not. Or, people who want to kill venomous snakes that are in their yard. And I'm not saying that's the worst thing in the world, but it's also, it puts you into situations that can turn into dangerous situations. Um, but it is good to be able to tell that this snake is venomous or not venomous. So you shouldn't be sticking to this belief. Another thing people use is their pupil size, like if it's cat-like or a slit pupil. And so they say, oh, it's not got a slit pupil, it's not venomous. Well, here we have an example of two copperheads right next to each other, one with a completely dilated eye and one completely not. And you can tell that in one situation, if someone was deciding that this is a non-venomous snake, this would be a very dangerous situation. This one is, so I have two pictures there. I have a cottonmouth and a diamondback water snake. So with the cottonmouth, people usually believe that the venomous snakes, like cottonmouths, float on top of the water, and non-venomous swim under the water. And also they believe that snakes can't bite you underwater. I love to go canoeing and floating. And so like we see snakes out there all the time, and you always want to be careful. You can definitely get bitten underwater. That is always a risk. If you step on a snake under the water, you can definitely get bitten. And then you shouldn't be identifying snakes based on whether they're floating or not. They all have the ability to adjust the amount of air in their lungs and create their buoyancy. So I just wanted to highlight a few points of identification. So with the cottonmouth, we do have the triangular shape, but we're not going to stick with that alone. Then we have the heat sensing pits they have. It's right between their nostril and their eye. And then they have the slit-like pupils. And then they have a scale that goes over their eyes. So like when I am out in the wild and I see a snake, those are things I'm looking for, because the first thing I want to identify, is this venomous, is this not? And then, you proceed with the situation. And cottonmouths also have a band that goes across their eyes, but sometimes that's difficult to see. With the water snake, we have a round head, round pupils, and we have vertical labial lines or lip lines. And so that's a really easy way to determine if you are interacting with a water snake and not a cottonmouth. Pretty much every time I've gone to a pond or lake to go fish, there's someone who's like, oh, there's a cottonmouth, watch out. And then, knowing me, I go over there to look for the snake, and it's just a water snake. So now we get to the very medical side of this, toxicology. So snakes have hundreds of toxins in their venom. And so we're mainly going to talk about two groups, the hemotoxins and the neurotoxins. So that is, these are the only ones that we really interact with. We get very different situations, and like none of what I'm teaching you, other than the fact that you should stay away from snakes if you don't know what it is, applies, because all the rules kind of go out the window. So with hemotoxins, we get many different situations, but you can have hemolysis, coagulation, or anticoagulation. And it happens really quickly. So within 15 minutes, usually people will have bleeding, swelling, and I've got some amazing pictures at the end, but you'll see blistering, superficial necrosis, and blood blisters. And then those are signs of local toxicity. Once it becomes systemic toxicity, you can have nausea, vomiting, bleeding, and shock. With neurotoxins, it's completely different game. So with neurotoxic snakes, The venom can be inhibitory or excitatory, presynaptic or postsynaptic. The scary thing is you can get bitten, you won't feel it immediately, like the pain from a hemotoxic snake, and it can take up to 13 hours for the effects to fully realize. So that's a situation where you want to get to the hospital, but then your doctor should keep you admitted for probably the whole night just to see if any symptoms do set in. And the main way people die from neurotoxic snake venom is because they lose their respiratory muscles and they're not able to breathe. So what not to do when you get bitten. And this is really important because there's so much misinformation on the internet. And honestly, when you Google, like if I got bit right now and I Googled what to do, probably 4 or 5 of these would pop up as things I should do, even though they just are horrendous things. So venom extraction kits, we'll go over that in a second. I have a whole slide for that. Don't suck out the venom. This seems to make logical sense to me, but some people do attempt to do that. So when a snake bites you, the venom goes into your lymphatics and then eventually it'll circulate back into your bloodstream. And so, this is all moving very quickly. I think they said maybe 2% of the venom that's injected can be pulled out by like a venom extraction kit. And then obviously by sucking out the venom, you're endangering yourself and the person who was bitten because you're putting all your saliva and your bacteria in your mouth onto their open wound. Some people cut the affected area to bleed it out. That's also self-explanatory on why not to do that. Some people have been known to shock the area, and technically, yes, shocking the area will denature the proteins and enzymes, but the amount of damage you'll do to your own affected limb is quite severe to be able to actually get a significant amount of the venom disrupted. Don't apply ice, don't drink alcohol, don't eat food or take any other drugs or medications. Does anyone have any idea of what pain medicines not to take if you get bitten by a venomous snake?
Aspirin.
So NSAIDs. You want to stay away from any type of NSAID. And once you get to the hospital, they will probably give you a form of an opioid. And then definitely do not apply a tourniquet. So if you apply a tourniquet, what happens is you trap the venom into the affected limb, usually the hand or the foot, and the local toxicity becomes so severe that that's when people start losing fingers and toes. So this is an example from an article, I think it was in May in Arkansas. And so they were talking about this 4-year-old boy who was airlifted to the hospital because of the copperhead bite. And the mom said that she started using the extraction kit 3 minutes after the bite. And she extracted for 5 minutes until she saw fresh blood, and then 10 minutes more just to be safe. So anyone have any idea what she was pulling out of the kid? Any guesses?
Interstitial fluid.
Yeah, it was just like they're causing a lot of damage with no return. They're just pulling out fluid. They're pulling out blood at some point. They're just like bleeding their kid out. And then in the article, it quotes the Courtney saying, "The doctor said we reacted perfectly, and because of our actions and extraction of the venom, he will be fine." So I just hope that an actual doctor did not say that, because that would be wild. But also news articles should not be quoting people saying what other doctors are saying, because then you spread information like this. The news article also linked at least 5 times this kit on Amazon. And so it just seemed more like a ad than anything. So what to do in the field when you get bitten? So the first thing you want to do is either remove yourself from the situation or remove the snake. If you think that removing the snake is a bad idea, like if you think you're going to get bitten again, then definitely just leave the area until you're in a safer area. Then you have to remove all your jewelry, any tight-fitting clothes, anything that could cause issues while with swelling. And then you want to keep the victim calm, and you want to make sure that their heart rate is reduced as much as possible. So you got to talk them out of freaking out, which is hard when someone's been bitten by a snake. And then you should also keep a Sharpie in your first aid kit, and you should circle the wound, write the time, and then make a mark of where the swelling is. And they will continue this in the hospital as well, just to see how much swelling is going on over time. And then you need to get them to this hospital as soon as possible. Sometimes that can be like 4 or 5 hours if you're in the middle of the woods, you're hunting, or you've just gone on a long hike. So, call 911 if you can, or get to the car and get them to the hospital. And you should call poison control on the way, because most ER doctors are not well trained in dealing with snake bites. And the ER doctor themselves can also call poison control. So this is the unified treatment algorithm for snake bites. It's quite complex, but the point of it is, once you start getting swelling that crosses a major joint, you really need to give them antivenom. We have one antivenom that works for all the pit vipers. So you don't need to know what type of snake bit you. You just go based on the symptoms presented. So if it's a neurotoxic snake, like a coral snake, you won't see any swelling. You might have respiratory or cranial nerve defects, and then you can know we have a neurotoxic snake bite. Or you would look at swelling blood blisters, and you'd say, okay, this is a pit viper. We need to treat it with this antivenom. So that's the really nice thing is, everyone used to say, kill the snake, put it in a bag, bring it to the ER. Don't need to do that. You'll freak out everyone in the ER probably. And then during treatment, there's a couple things that are done or not done. So one of them is, because of the swelling, it looks like what they call compartment-like syndrome, because it looks like compartment syndrome. And so they go in and they will do a fasciotomy. That is almost never indicated. That is unnecessary, and if you treat them with the antivenom, the swelling will go down and the symptoms will be treated. So here we have an image of someone who got a fasciotomy because of a snake bite, and all the medical toxicologists that were talking about this case afterwards said, this was really contraindicated in the situation, and the patient had not been initially treated with the antivenom. And then the other myth was that, you shouldn't always use the antivenom because, it can be expensive, but that shouldn't be a concern when people are coming into the ER, but also because there are some adverse reactions. This is kind of a story of old medicine. So maybe like 30, 40 years ago, you would have serum sickness at a rate of like 50 to 75%. You'd have like 20 to 30% adverse reactions to the antivenoms. And so definitely it was a harder decision back then. Now there's a 1 to 8% chance of adverse reactions, and you can always just put them on epinephrine as well while you're giving them the treatment. So it's almost always indicated to use the antivenom. And then I was just going to show you some of so this is like superficial necrosis on the left-hand side, the top left, and then some blood blisters as well. And then the bottom right is just shows like how extreme the swelling can get. And you can imagine why someone would think, oh, this is compartment syndrome. We need to do a fasciotomy. And then here you can see, once you start getting into the rattlesnakes, they're generally bigger than these other snakes, which means higher dose of venom and more severe symptoms. You can see that there's like extreme bruising and swelling. And these are, I think most of these were within 12 hours of the bite. So swelling can progress even up to 24 to 36 hours. There's been people who have been admitted to the hospital for 4 or 5 days because of the snake bites. And if the snake bite is not treated properly, some of the lasting effects, there was a woman who had been unable to walk for 2 weeks because she was not treated with antivenom when she probably should have been, and she just couldn't put weight on her foot. And so it was a situation where the doctor should have used antivenom. He just didn't think it was necessary at the time, but then she still has issues because of that. And then here we have the Western diamondback rattlesnake, which I said was the biggest one. And so you can see the picture on the right is a patient that was bitten twice. There's 4 fang marks circled there. And they were in the hospital for an extremely long time. And then the woman on the left, her situation was 2 weeks later, she was still having symptoms, and she was also being treated with antivenom. So part of the issues sometimes that happens is, the antivenom is administered and you do elevate the limbs, the affected limbs, but sometimes the venom still gets trapped in like small digits in your fingers and toes. And then when you leave treatment and you're going back home, sometimes that venom starts to move back out. And so then you get symptoms of reinvenomations. And so I did want to mention some of my research and future aspirations. So I'm currently working on a project with a medical toxicologist to update the treatment algorithm to ensure that antivenom is being used more often, because we don't want these permanent lasting effects. I'm also working on a project to do like a literature review on envenomations by a different type of pit viper that's in Southeast Asia. So bites in South Asia and Southeast Asia are a lot more dangerous and a lot more common. I think it's almost 150,000 people die a year from snake bites, and that's generally in India, which has a massive concentration of venomous snakes. And then my future aspirations, I plan on being a hemonc doctor. We'll see what happens. But I want to work with the different toxins of snake venoms and work with them to inhibit growth and metastasis of tumors. Fantastic. Yeah, maybe I shouldn't go into onc. Yes, exactly. And then this is a slide of pictures of me holding snakes. So yeah, definitely showing off. But so do you guys have any questions about snake bites or snakes? Yes, Zoom as well. Somya?
Anyways, so the question was, with humans, you can usually tell if you get something bit me, but with dogs and other animals, if you go hiking, what are like signs to look for or precautions to take?
Yeah, so that's a really good question. So there's over 100,000 venomous snake bites to pets in the US every year. So it's a very common issue. One of the most immediate things that people find is the swelling as well. So the symptoms are similar in that way. And so the dog in your case might like be yelping or signaling that it's in pain. Or you just have to like, if the dog is acting strangely or lethargic or anything, showing symptoms of like systemic toxicity, you can look for a bite mark in that sort of situation. And then go to an emergency vet, and they also have antivenom specifically for dogs as well. But yeah, I would look for similar, the bite marks, the swelling, and any sort of bleeding.
I see these pictures are really cool that you've handled like a lot of these snakes before, but I was just curious as to which one of these you were actually most apprehensive, because it looks like you're not scared at all, but like which one was like the most terrifying for you to do?
Okay, that's a fantastic question. So I turned on my Apple Watch when I was doing this, when I was picking up these snakes, and my heart rate was averaging at 160. So I was very apprehensive throughout the entire process. But specifically the Eastern diamondback rattlesnake, it was the biggest one. I think it was around 4.5 feet. And so I was definitely very nervous. But with the proper training and techniques, you can put yourself in a situation where you can properly handle these venomous snakes and do whatever you need. So like for me, I want to be able to use these techniques to help relocate, like if someone has a snake in their yard or some situation like that, I could help relocate them away. And before I did this program, I was not able to. If someone said they had a cottonmouth, I'd be like, okay, call someone else.
Yeah, we have a couple questions from the Zoom chat. If you don't initially see the snake, how important is it that you try to identify and find the snake?
So we're going to go based on symptoms only. So if you have swelling or something like that, you would say, okay, this is a pit viper envenomation. The likelihood of being bitten by a coral snake is extremely low. They're semi-fossorial and they are almost never found in Arkansas. But for the most part, you do not need to go looking for the snake at all. You would just treat based on symptoms. And so for the person being bitten, you would not want to go looking, go searching, and potentially risk another bite.
And then a follow-up on that, does the pre-hospital treatment change based on if it's neurotoxic or hemotoxic venom?
Slightly. You can do some stuff that's very specific to the neurotoxic venom, but if you stick to the pre-treatment that I had said, that works for all of them. The only thing that you could do additionally is you would take the affected limb and you want to immobilize it with a slight, like you could use like an ACE wrap or something and just wrap it up and keep a slight pressure on it. And then keep it at or above heart level. But that would be the only difference.
And then our last question right now from Zoom is, do you have any preferred or recommended snake identification tools or apps or anything like that?
Yeah, so honestly, the best way to learn how to identify snakes is on Facebook. There's a group called the Arkansas Snake Identification. There are national ones as well, but that can be really overwhelming. So what I did was I started with resources from Arkansas, and then I've kind of worked my way outside of that. So I think it's called Arkansas Snake Identification on Facebook, and you have actual professionals who are either physicians or you have actual herpetologists and PhDs who identify what the actual snakes are. But in that way, people are able to post if they have questions on what's in their yard, or they're able to learn based on what they see on that group. Okay, so this is Apollo. He is my Brazilian rainbow boa. He's a 1.5 years old, and he's very chill. He likes to hang out while we study. He's gonna live until he's 20, so they have really long lifespans, and that's about it.